My name's Amanda. I'm a physical therapist with Physio, Physical Therapy and Wellness over on Merriman Avenue. I'm a physical therapist as well as an athletic trainer. I grew up here in Asheville. I did a stint in Atlanta for a little while to do residency and fellowship, and now I'm here in Physio and I absolutely love it. It's good to be home. So let's dive into some ergonomics. This is a question I like to ask everybody. So what do you think? How many hours a day does the average person spend sitting down? Is it 7 hours? Is it 6? Is it 8? Or is it 9? When I did my own research on this, I was absolutely flabbergasted to know that the analyses suggest that on average, each of us spends about 9 of our 14 waking hours in an office chair or on the couch. So that's a lot of our hours of the day to be sitting down. That's a lot of stress on our body in a sitting position, comparatively speaking to moving around and being active. And so that's why I think this ergonomic topic is so important. If your ergonomics aren't great when you're sitting at your desk, then you're going to have breakdown, you're going to have pain, things are going to happen. So that's kind of what we're going to address today, which brings me to the next slide of objectives. We want to learn the benefits and components of proper posture. We want to learn the appropriate ergonomic desk setup for sitting and standing desks, because standing desks have become much more popular as of late. And we want to learn a few stretches and exercises for posture improvement and overall awareness. So some of the common aches and pains that I've been seeing lately that have to do with ergonomics, and especially around the pandemic, because there's a lot of people that have gone from their office and their really nice setups to now they're home and they're trying to navigate working from home now. So we see a lot of neck pain, we see headaches, which are directly related. We see low back pain, and we're also seeing some hand pain because the way the computer is set up and the stress and strain that your wrist and hands get is also just as important as making sure your neck and back are in good positioning as well. So a little bit of anatomy, you'll see the spine on your screen. There is the cervical spine, the thoracic spine, the lumbar spine, and then you go into the sacrum and the coccyx. The biggest thing I want to point out is that on the left-hand side picture, so the lateral side of the spinal column, we all have a curve. We're shaped that way for a reason so that we can navigate the forces of gravity, or as we're walking and the ground pushes back up against us. Our spine is shaped like that so we don't fall over, number one, but number two, so we can take forces appropriately through our spine so that not all of our other joints take just that force by itself. So you'll hear me talk a little bit about like the cervical, the thoracic, and the lumbar spines. I wanted you to have a visual of that. And the other thing I notice sometimes is people kind of break themselves up into chunks, like they're a neck person or a thoracic person or whatever. You're all one big spine, and they all directly relate and correlate with each other. And if you have a dysfunction at your neck, it's very possible that you can have a dysfunction in the mid-back too, or sometimes the stiffness in the mid-back drives that cervical pain. So I just wanted you to have a visual of that. So some of the overall effects of poor posture, we see that there's a misalignment of your musculoskeletal system, which is basically the scientific definition of poor posture. One of the main effects is there's a wearing away at your spine. So it makes it more fragile and a little bit more prone to injury. It can cause that neck, shoulder, and back pain like I just spoke about. It can overall decrease your flexibility. So one of my biggest examples of that is, and you can all do this with me, it's kind of a fun experiment. So if you're sitting in like nice proper posture, you raise your arms up above your head, it does just fine. If you slump over forward, your arms don't go up very well. So that's where some of that flexibility comes into play, is when in a fixed abnormal posture, things don't want to move appropriately. So that brings me to that next point of affecting how well your joints move. Your shoulders are a prime example of that. The hips are another example of that, which then affects your overall balance, and it increases your risk of falling. If joints aren't moving appropriately, then muscles usually don't function as well. And then you have a decrease in balance, or that increased risk of falls, because your muscles don't want to fire as efficiently as they could to be able to help you maintain and navigate on level surfaces or hiking or whatever your thing is that you're doing. It makes it harder to digest your food. If you're all slumped over, your tummy and your digestive tract is all kind of squished. so things don't move as well. It also makes it harder to breathe because your diaphragm doesn't have room to expand and contract like it's supposed to. Some benefits of good posture, obviously just the opposite of everything that I just mentioned. It does keep your bones and joints in the correct position or alignment, so that muscles are being used properly. And I like to tell people, and I tell patients this quite frequently, we're nothing but a bunch of physics. All of our joints are levers. So if those levers aren't working like they're supposed to work, then things happen to us. And that's just the physics part of our body. And it's really cool to break down some of those things and look into them. It overall helps to cut down on the wear and tear of joint surfaces. So your spine, your knees, especially if you're a standing person, and it does help to prevent the onset of arthritis. When you have wear and tear on a joint in an abnormal way, then you have cartilage that gets worn away, and that's where arthritis can happen. It decreases the strain on the ligaments of the spine. So if you're in that abnormal posture, our ligaments are getting challenged inappropriately, is probably the best way to put it. And they do stretch over time. Think about if I had one on, like a hair tie, for example, the more times I put my hair up, the more stretched that hair tie gets. Our ligaments respond very similarly to that. It prevents the spine from becoming fixed in abnormal positions. Our bodies are really cool and they're very efficient. And when we place ourselves in positions for a longer period of time, our tissues adapt to that, whether that's our muscles or our ligaments, our joint tissues, everything adapts to those positions that we put ourselves for prolonged periods. And we want to be conscientious about that. It prevents fatigue because the muscles are being used more efficiently. So that allows your body to use less energy. And the big thing is preventing backache and any muscular pain you may have. So proper desk setup, especially with sitting, one of the biggest mistakes, quote unquote, that I see people make is the screen height being either too high or too low. So your monitor height, you want the top of your monitor to be eye level with you. That prevents some of the getting your head forward. It prevents you from having to look up and getting some of the neck strain behind. So that's very helpful. The chair height, as it's related to the desk and keyboard height, is also important. To maintain your arms in a nice kind of 90 degree place to work on your keyboard is really important because that helps to cut down on the strain at your neck. You know, if your keyboard and things are too high, then you scrunch your shoulders up and that's where you get some of that neck tension. If it's too low and you're trying to reach, then that's also creating tension in its own right. If you're using a laptop more instead of a desktop at home, you want to have your laptop up on a stand. I suggest sometimes having a separate keyboard. That way you can work at an appropriate height keyboard wise, but your monitor level can be at the correct place. For standing desk setup, it's very similar. Common mistakes I see, again, the monitor height, the keyboard height. It really kind of comes back around to just poor standing posture in general. I tell people quite frequently to set their desk or their rear view mirror in the good posture where they want to be. And then when they can't see things correctly or they can't see out of the rear view mirror appropriately, then you want to adjust you instead of all of your desk setup. So that's a good helpful hint as a way to do that. And there'll be some contact information for us at the end of this slide, and or not this slide, but at the end of the presentation. And you can contact me. I have a handout of this desk setup for reference. The other common big mistake for a standing desk is not having supportive shoes or an anti-fatigue mat. Those things help your spine and the rest of your joints take gravity over the course of the day and not feel so squished and exhausted. So just a couple extra ergonomic equipment that I recommend. If you're having a lot of that wrist and hand pain, having a wrist rest for your keyboard is good. A wrist rest on your mouse pad to help you maintain a little bit more of a neutral position at your wrist. An ergonomic mouse, if you're somebody that does a lot more mouse work versus keyboard work, might be in your best interest. Document stands are really important, just like your monitor height is important. If you're constantly looking down at your document to work, that's also going to create issues. So being able to just look to the side, whichever direction you're more comfortable with versus down, is good. Sorry about the sirens in the background. And also a lumbar roll, something behind you to maintain the position of your lumbar spine. My big suggestion for that is you don't want to find something that pushes you forward. You just want to find something to take up the available space so that you can sit in a nice relaxed position and your spine supported. The good habits I recommend: take short breaks. If you don't take anything else away from this presentation other than get up out of your chair every 20 to 30 minutes, even if it's just a 1 to 2 minute stretch break, or you just stand behind your chair and wiggle a little bit, get out of that position every 20 to 30 minutes. You want to take a break and change your task after you work for about an hour, even if it's 5 to 10 minutes to like hop on Facebook or do something different, go wash your dishes, change your brain, because it's going to help to keep you from being so fatigued. And you want to try to get away from your computer during your lunch breaks, or if you're working later in the evening during your dinner break, however that works for your schedule. I think it's important to get out of that position, get out of the posture. It's good for your eyes, to be able to take that break. To avoid eye fatigue, you want to rest and refocus your eyes periodically. When I was preparing to take the PT boards forever ago, one of the things that the course told us when we took our exam prep was every 20 minutes, stare away from your screen for like 20 seconds. And I can tell you, it really did help with that brain fatigue and eye fatigue with taking an exam on a computer. So that's that look away from the monitor and focus on something in the distance. Sometimes you just need to rest your eyes and you need to cover them up. If your eyes are seeing light and they're seeing TV or whatever you've got in your room, your brain's processing, your eyes are processing. So sometimes they just need the dark. So just, covering your eyes for 10 to 15 seconds can be really helpful. Use your correct posture when you're working, and then try keep moving as much as possible. So maintaining a good exercise routine outside of your workday is really important. So just a couple of quick stretches. Hopefully the pictures are good. If you need some more helpful hints, you can always come in and give us a call here at Physio. We're more than welcome to help you out there. So upper traps or levator stretch, you want to take a hand and kind of tuck it behind you, or you can sit on it, whatever. You just need your shoulders stable. You're going to just take your head away, nose towards your opposite armpit. Or do the other side, you can see better. I just think about did I put my deodorant on this morning? That's my helpful hint to my patients to remember this stretch. The scalene stretch, if I want to stretch my right side, I'm going to take my left hand and put some pressure on my collarbone. And then I'm just going to take my head and lean it away. And that really focuses the stretch just to right here. So you want to hold this for 30 seconds. And really all of these stretches are 30-second hold. And then the other two components of this stretch, you go from your starting position, you can turn your nose up towards the ceiling, and that focuses it more to the front part of the scalene, or you turn your head towards the floor, and that focuses to the back part of the scalene. There's a doorway stretch for your chest. The longer you sit, the more forward you get, the shorter these pecs go, and then that sets you up for shoulder pain, neck pain, headaches, the gamut. So you would put your arm into your door frame and step through. You should feel a nice stretch come across your chest that way. Squeezing your shoulder blades every now and then. When we talked about that, taking a break every 20 to 30 minutes, taking that time to do a few shoulder blade squeezes, a few chin tucks back, just to reverse all of that forward rounded posture is very important. And then the last picture on the list, what she's doing is she's standing, she's placing her hands on the table, and she's opening up. So she's making herself like a book to open up through the mid-back region to really rotate and stretch through the spine. Some other exercises, if you're a gym goer, rows are really great. Lat pull downs, any pulling motion that you're really working on those back muscles helps to combat that forward posture. When you're forward, the rotator cuff muscles lengthen out. So we do promote stretching and strengthening those. So external rotation exercises, horizontal abduction, which is taking the arms out. You can do those with dumbbells. If you're on your belly or bent over, you can do that with a resistance band. There's a lot of ways to accomplish that. These are very Googleable terms, and they're very popular in the exercise world. So you can definitely find some examples of these online. And then a foam roll. Foam roll mobility is wonderful. It's important. I do it regularly to keep my body going through PT. It's also just as important to do it if you're somebody that works at a desk. So there's that information that I mentioned to you. My email address is there. Our phone number is there, our address. If you need anything, have any questions, you're more than welcome to contact us. We can talk to you about insurance. We can talk to you about how you can get in to see us. We offer lots of great ways for you to come in and get better, especially if you've got some aches and pains that I've mentioned. Thank you so much for tuning in. I hope this was helpful. Let me know if you have any questions.